At the end of Chapter 1 of this series, we noted that the surgical world stood on the edge of a surgical revolution in 1969. We move on now to Chapter 2 to see how this unfolded. As this is an educational video, there will be references provided along the way for you to verify the facts presented. Please note that this information is not intended as a substitute for a surgical consultation, and patients are encouraged to see their doctor for appropriate treatment planning. In Chapter 1, we discussed the history of breast cancer surgery as it is recorded in medical journals from 1898 to 1969. In this chapter, we will look at the significant events which unfolded between 1969 and 1994, which led to a paradigm shift in the surgical treatment of breast cancer. A visionary surgeon from Italy, Dr. Umberto Veronesi, applied to the World Health Organization to perform a study comparing quadrantectomy and mastectomy, and this trial was approved by WHO in 1969. The operation that he termed quadrantectomy is the predecessor of what we call breast conservation treatment today. Initially, this was met with significant criticism, mainly suggesting that the surgical therapy would be inadequate, but Dr. Veronesi pressed on. And we know today that his pioneering and persevering spirit revolutionized the surgical treatment of breast cancer. Recruitment of patients for this study began at the Milan Cancer Institute in 1973. In total, 701 women who had breast tumor sizes of no more than 2 centimeters and without clinical evidence of spread to the lymph nodes or elsewhere in the body were included in the study. They were divided at random into the standard treatment group, or those who would undergo mastectomy, and those who would undergo the new procedure, the quadrantectomy group. Dr. Veronesi reported his preliminary findings in 1977 and 1981. He found that there was no difference in 5-year survival between the group of women who had mastectomy and those who underwent quadrantectomy. We will recall that at this point in time, Dr. Halsted's concept of 5-year survival still stood as the reference point for treatment efficacy. In other words, the standard by which a treatment strategy was assessed was based on what percentage of patients were alive and disease-free 5 years after treatment. Dr. Veronesi took this one step further. In 1985, he reported 8-year survival data. It was noted that 79% of women who underwent mastectomy were alive and had no evidence of relapse, while of those who underwent quadrantectomy, 80% were alive without evidence of disease. About 3 years after Dr. Veronesi began what we refer to now as the Milan 1 study, Dr. Bernard Fisher of the United States began a study evaluating the efficacy of breast conservation treatment. In 1976, he started recruiting women who had cancer which were no larger than 4 centimeters and divided them into 3 groups. The first group underwent standard treatment with mastectomy. The second group underwent segmental mastectomy with radiation to the breast, and the third group underwent segmental mastectomy without radiation. While initially using the term segmental mastectomy, Dr. Fisher later referred to this surgical procedure as lumpectomy. In 1985, Dr. Fisher reported the 5-year survival data for his study, which was also known as the NSABP B06 trial. There was no difference in overall survival in all 3 groups of patients. This study, as well as the Milan 1 trial by Dr. Veronesi, analyzed the treatment outcome of patients who had invasive breast cancer in its early stages. In 1994, seeing that there was no survival difference for women who underwent mastectomy or lumpectomy for women with invasive breast cancer, Dr. Fisher suggested that breast-conserving surgery can be extended as a form of treatment for women with non-invasive breast cancer who prior to this were also treated with mastectomy. Non-invasive breast cancer is a condition also known as DCIS, or ductal carcinoma in situ, and represents breast cancer at an earlier stage than invasive cancer. The Milan 1 trial, led by Dr. Veronesi, and the NSABP B06 trial, led by Dr. Fisher, form the pillars that resulted in the paradigm shift of breast cancer surgery. The foundation of breast conservation treatment, which encompasses the terms quadrantectomy, segmental mastectomy, and lumpectomy, were laid as a consequence of these studies. There were other similar studies performed in the years that followed, with conclusions mirroring those of the Milan 1 and NSA-BP B06 trials. These convincing data led the National Institutes of Health to issue a statement in 1991 that breast conservation treatment was preferable to mastectomy for stage 1 and 2 invasive breast cancer, as it provided equivalent survival while preserving the breast. We can appreciate that it took a great deal of effort to effect the paradigm shift from mastectomy, which was the mainstay of therapy for breast cancer from 1898 to 1973, to breast conservation treatment, or BCT, as the preferred approach for the treatment of stage 1 and 2 invasive breast cancer in 1991. BCT was then accepted as a suitable alternative to mastectomy for DCIS in 1994. This movement in surgical philosophy provided the catalyst for another change in treatment concepts, signaled by a study done in 2007. Let us now move on to the next chapter, which heralds exciting times for women diagnosed with breast cancer.